without further ado, I'm going to hand it over to Jodie, and she's going to start the session.
Okay, thank you, Emma. So our first slide that's up tonight, overseas immunisation records. Now, we've all seen them. This is what we usually get when we go into general practice. You get this nice bit of paper that's not in English, that you can't understand it, and then you're asked to do a catch-up plan. Simple, right? No. So just wanted to remind, before we move forward, I just wanted to remind everyone that I will be talking about WA-based schedule tonight, because that's obviously where we are. I know the schedules, we've got some people on tonight that are from other places in Australia. Your schedules might be slightly different, but just remember that we are actually talking about the WA schedule. So first advice would be to ensure that your vaccine history that's presented to you is either in English or that you are confident enough to understand the language that it's actually written in. New people settling in Australia can access free translation services through Home Affairs or the Department of Social Services. Next one, Emma. Okay, and so then we've got so the vaccination calculators that you can use. So what do you use to get yourself a catch-up plan? So there's several different ways you can calculate whether or not a child needs a catch-up plan, and some prefer to use a paper-based version if you're a little bit older, like myself. That was what we used to use straight from the immunisation handbook. It's easy to use, and then once the immunisations that the child has had are added onto this plan, the need for a catch-up is relatively clear. The immunisation handbook also has a link to an online calculator, and this resource is being updated on a regular basis and allows you to add the vaccines, and then it will produce a catch-up schedule for you. This one has its limitations. It's only available for a child who is under the age of 10, and there are a few vaccine schedule things that are slightly different that you may need to correct. I'll show you a couple in what I mean in a minute. But you can always create, alternatively, you can always create an AIR profile for the patient if it doesn't already have one. And then you can add the overseas vaccinations directly onto AIR, which Michelle is going to show us later on. And this will create an overdue catch-up plan for you by telling you when the patient was overdue, but it won't give you the interval dates that or when the vaccines should be given. So knowing your schedule and having your immunisation handbook handy are the best ways for you to interpret the records. And we also strongly recommend that you discuss the catch-up plan with either another nurse within your practice who immunises, a doctor, or over in WA, we have the Metropolitan Communicable Disease Control, or MCDC, and the Communicable Disease Control Directorate, CDCD, and they're happy to assist you and look over plans and catch-ups for you. Okay, so tonight I'm going to go through two different vaccination records that I've actually received from MCDC. So these are actual real live, this is what they've received catch-up plans, and we will go through them in both paper-based and on the calculator. And then you can see the difference between the two. So I am just going to share my screen. Okay, so here we've got the catch-up calculator, and the first person we've got is a young lad called Tom. Tom's from Pakistan. Tom's had a few vaccines. I will show you his record very shortly. He's had a few vaccines. They are in English, so they are in a different language, but they also are in English, so there was actually no need to get it translated. And so MCDC provided us with his thing, and this is his immunisation record. And so we're going to pop them all into the calculator. So your pre-screening, so this is the page you come to in the AIR handbook. So your pre-screening is Tom's date of birth, which is the 28th of November in 2017. We're getting the information from all these different places. So it's an overseas record of vaccination from a doctor or physician, and it's in English. He doesn't have any medical conditions that we know of to increase his risk, so we click no on that one. And we're just going to call him Tom. Okay, he's moved to WA. He's a male, and he's not of Aboriginal or Torres Strait Islander origin that we know of. So then on this particular page here, we do a vaccination history. So how do you wish to enter the vaccination history? We want to do it by antigen because their vaccinations most likely are going to be different to what ours are. So we click onto the next screen. In this section here, because we're adding the antigens, we'll toggle these ones to off. So it gives us a bigger range of vaccines that he's had. And so his first vaccines were done on the 30th of November. In 2017, just after he was born, he had a hepatitis B. So we'll pop a hepatitis B generic in that one. He also had a BCG. But if you scroll through this screen, you will notice that there is nowhere for me to put BCG because it's not on the Australian schedule at all. So it's not one that we would actually include. If we were doing it directly onto AIR, we would include it. So we click submit and then we add another date.
Okay, so I have already logged into the AIR test site because I have the information that Jodie was going through. So that hopefully looks familiar to the majority of you that have logged onto our AIR site for assistance. Now, Mary, of course, has come from overseas, so we're unaware if she has a Medicare card. So I'm just going to pop her details in here. And as you can see, just using the calculator to help wherever I can so I don't have to key. So we've got her date of birth there, 19th of April 2020, and female, and we're going to do a search. Okay, well, that's great news. Mary has got a Medicare card. So we've got her details up the top here, and we can just scroll down to have a look now. As Jodie mentioned, lots of due details, but that is showing everything because at the moment, if we come down here to immunisation details to look at her immunisation history, and you can see as it stands at the moment, while she's got a Medicare card, no immunisation history at all has been updated on the AIR. So that's what we're going to start with because we won't pay attention to this until we've actually input the information that we have. So we're going to record an encounter. First question is always who performed it. Now, we know these have come from overseas, so this encounter was performed overseas. And just click in here and we can start to key in South Africa. And we choose it down the bottom there from the drop-down box. Always when you're putting in any information from overseas, don't follow the schedule because as Jodie said, our schedule is different. And if we were to select 2 months, for example, we're only going to get what at 2 months we would be giving in Australia. So always leave that defaulting to other. And that way you will get all of your all of your vaccines shown. So the first one we have was the 20th of April 2020. There we go. And we've got the BCG and batch number. Now, when they're overseas, you may not have a batch number, which is fair enough. So what you input is not recorded, all one word. And then we just choose birth dose. And we have a second vaccine for that day, which was the polio. Now I have a generic. So I will just scroll down and find that one. Oops. There we go. That one I've got a batch number for. And birth. And we add those two because those were the only ones on the 20th of April. So we add. All right, but we've got more. So we're going to add more. Okay, again, we're defaulting to overseas, which is great. Country doesn't though, so we've still got to put in South Africa. Schedule, other. And now these ones were on the 3rd of June. 3rd of the 6th. All right, we'll start with the DTP. It always does that to me, so I'll just go back. Remembering this is our test site, so it's not 100% perfect. So the DTPA is dose 1. And we have more. We've got the polio again. There we go. I'm just putting in a makeup batch because it's just easier when I'm demonstrating for you guys. We've also got Hep B, generic Hep B, dose 1, and another one. We've got the, yep, put that in, dose 1, and another one. We've got a pneumococcal. Ugh, did I spell it wrong? Probably. I think you said Prevnar 13, didn't you? Yes, you did. That's right. Dose 1. No, it wasn't birth. Dose 1. And then add. Okay, so we've got those 5. 1, 2, 3, 4, 5. But wait, there's more. So we go back. Country of immunisation, South Africa. Other. 3rd of June, it still is. And we've got the roadshow. There it is, generic. And dose 1. And add. Okay, but we can keep going. A lot of people see that they can only add 5, but you can just keep on going and you'll be changing your date of immunisation as you go. And now we've got the 5th of July. Okay, and we've got the D. That one again. We're on dose 2. And the polio. Again, dose 2. And then Hep B. Dose 2. And yep. And dose 2. Oops, there, dose 1, dose 2. And add. And we've got ACT hip and batch dose 2. And that's when you no longer can see the plus sign, we've run out of space, so to speak. So we click add. And we've got them all here. Just to point out as well here, if for example, I'd gotten the wrong date or the wrong vaccine, the pencil, you can edit it, but if it was completely wrong, you would use the trash can and to delete it, because at this point, whilst it's all sitting there ready to submit, we haven't submitted it. So we want to add another one. I was up to, yep, 5th of July. Okay. Yeah, we've got, yep, those 2. And then dose 2. And that's everything for the 5th of July. So we add. Okay, and we've got more. So, no, not the Solomon Islands. South Africa, that's better. Okay, now we are on the 5th of August. Scroll ahead. Okay, and we've got TPA again. Why do I do that? Okay. And we're up to dose 3. And add. And polio. Dose 3. And add. And Hep B. And dose 3 again. And add. And yep. Dose 3. And then we've got pneumococcal, those 3. And so we add, because that's the last from the 5th of August. All right. And now we've just got a couple that, as Jodie said, she didn't put into the calculator, but we obviously want to record. So we have a complete record of what the child's had. Now we want to scoot to 2021, February the 3rd. And we have had generic measles. And that was dose 1. And we also had generic rubella. And I chose the wrong one. So we just get out of there. Generic rubella. Okay, and that was also dose 1. And then we've got a yellow fever. Generic yellow fever. And dose 1. And add. And we're up to the last group. Just thinking about that, it's just saying this is all too much for me to deal with. Come on, there we go. That's better. Last one. And South Africa. Yep. Okay. Other. Now, this was the 3rd of November. Alrighty. So we've got the measles again. Dose 2. And we've got rubella. Don't know why it is. Why do I struggle with rubella, for goodness sakes? There we go. Okay, dose 2. And then we've got yellow fever. And dose 2. And add. Come on. No, don't be. I'm waiting. Don't you dare. We will wait. Oh, okay. So again, we can, as I say, check, have a look. There it all is. There's the November ones, and we hit submit. Oh, there you go. It's telling me the generic for pneumococcal and Prevnar 13 contain the same antigen. I'm just going to submit anyway. Just get past it. Or are you going to make me deal with it, are you? Did I put it in twice? Maybe I did. Hang on a second. My apologies. Prevnar. Meningococcal. No, I cannot see why it wants me to have problems. Just ignore it. Same antigen. Can you work out why it's carrying on there, Jodie?
I'm looking.
I'm looking, yeah. I don't think I put in 2, did I? Accidentally? I know there was a lot we were putting in, but anyway.
No, I can't see it twice.
Maybe this one here. Oh, no. Maybe I'll just edit it and make it generic so we can demonstrate that.
Oh, no, it is that one. So the 5th of July, you popped in a Prevnar 13, and then you also, in the second batch, there's a generic pneumococcal.
Well spotted. Well spotted.
You
could see it. I couldn't.
That's the gold star.
I had to put my glasses on.
Yeah. Did,
All right.
did anyone else in the chat notice it at all? You also get praise.
Yeah. All right. So we are
Nothing
on,
in the chat.
Oh, Mr.
All right.
Opportunity, guys.
so we're on the 5th of July, and I want to get rid of, right, I'll get rid of the generic. Where is it? Okay, this one here. So hopefully, I don't know that I've had to do this before in the middle of so many, Jody.
Sorry.
I'm blaming you. Let's see if I can get rid of it. Let's just see if it'll update.
Yeah.
Okay.
So anyway, that was my fault. So I would tell you it was a test, but I was so blind looking for it. You obviously know it wasn't. It was a genuine mistake. Come on. Don't do this. Okay, what's happened now? Have we got rid of it for the 5th of July? Let's have a look.
Yep.
Yes, we have. Thank goodness. All right. And we submit. Okay, so what it is just giving you, this one's a warning as opposed to the other one that wouldn't let me proceed. It's saying that the encounter requires clarification, but that's fine. We're just going to confirm because we want to get this recorded. All right, so we've finally got all of that on the system or on the air, so to speak. And you'll see now when we come down to Mary's immunisation details, she has some history, which is great. Now, it's obviously in oldest first, so just click on there and you'll get the most recent first. So that's what I always do. And now if we just close that up and have a look and go into individual details, we can see now her due details. Now let's hope her due details, Jody, match yours. So
I'm going back to mine and I'm having a look.
you're having a look. Yes,
I
good,
am
good,
having a
good.
look online. Well, it says
Yeah.
that she needs, yep. It
Yep.
says that she needs mumps, but I mean, that would be an MMR.
Yes, yes.
But
That would
otherwise,
cover
yes,
that.
it matches the recommendations from, funnily enough, the Australian Immunisation Handbook.
Brilliant. That's what we want. Okay, now we can obviously see due dates here that are well in the past. So the child isn't up to date, which of course is correct. Now, were we giving some today, Jody, in this scenario?
Yes, we were.
We were. Okay, so we've put through all the history. Now we're going to record some actual immunisations that we've done today. So now that's I performed this encounter. Again, we'll still disregard the schedule so that we can get everything up. So it's based on the 28th of September this year. Is that right, Jody?
Yeah,
Yep.
that's right. Yep.
All right. So these were given then. And we're going to input the DTPA. Oh, okay. I think it's the keyboard doesn't like it in this office.
So you could, I was going to say you could put Infrinrex for that one if you wanted to, Michelle.
Good, because I can't obviously put a generic, a not known batch since I'm doing it. So can't even spell it. Infrinrex. INF. That's why ANRIX. That's better. Infrinrex. Yep. And the batch number. And it was dose 4.
4.
Yep. Okay. And we also gave.
We also gave a hepatitis B, so an Energix B or a HB.
Energix. Don't believe it's got the Energix. What was the other option? Sorry.
HB.
HB.
So H-B.
That's what we want.
The one.
Okay, and that was also dose 4.
Yep.
And
then we'll give her an MMR.
Okay, get out of that. MMR.
Yep.
And that is dose 1. Is that right?
It's actually technically, well, yes, it's dose 1,
Yeah.
but technically dose 3.
Yeah, I think our system is going to say dose 1 because we
Yeah.
haven't had MMR before. And we've also got...
And the last one was the HIB.
Yep. Okay. And that is dose 4.
Yep.
All right, let's add those. And now, this is new. I don't know if any of you all seen the recent email that's gone out from the Department of Health to talk about the vaccine types that is now required. It's not required as yet. I think it's January 1. It's brand new. It only gets rolled out this weekend over into the actual Real Air site. So I just had to say they were all on NIP and add. All right, again, we get the opportunity to check everything and we're happy and submit. And again, we need clarification. We're going to ignore whatever it wants to confirm, and we'll have another look at her individual details. And we've still got, obviously, some things there, but that's because some of them require clarification. So, yeah. So what we would need to do, obviously, we've not been able to give everything on the one occasion. So we would then pop her on a catch-up to give the parents guardian the 6 months in order to bring her up to date. And just remember, not that it's a last resort, but you always first of all want to put everything in because of the interval that needs to be between vaccines. They could already have like a short period without needing to be put on the catch-up. If you see here that, maybe it's 3 months because of the period between vaccines, then I wouldn't be putting them on the catch-up at this point, simply because you only ever get the one catch-up. And then if you use it now, when in effect they've got a 3-month grace, then they can't have it again. But in this case, there is no 3 months grace. So we would put this child on a planned catch-up and save. And that now gives her the catch-up until the 30th of May next year in order to be brought up to date. Okay. That is my little bit in the air site. So I will unshare my screen.
Thank you, Michelle.
Thank you.
And as well, I'm getting the PowerPoint up. If you make sure that you do put in the chat if you have questions, because it's going to be, this is your chance to ask questions from people that know. Okay.
There's no questions, Emma,
yet.
but I think Verlin's maybe got her hand up. Verlin, unfortunately, we can't unmute you. Would you be able to put it into the Q&A chat function?
Thank you, Verlin. Okay, over to you, Jodie.
So if you want to just flick to the next one. Yep. Okay, so just so that's pretty much the presentation itself. Just a couple of little reminder points for you. So just remember that the online calculator is only for children under the age of 10. If you're lucky enough to be over here in WA, MCDC has a request form that you can use to help you clarify any uncertain catch-up plans. We will send you out that link for their request form in the resource pack that we send out. All vaccines that need to be added to AIR as encounters, you need to ensure that the correct batch numbers are put in if they're known, and you may need to create the full account. So if they haven't got a Medicare card, you click record encounter and you put in all of the child's details and you basically create them their AIR account. Always consider the adults in the room as well. If you're doing an overseas catch-up, parents are bringing their kids in for vaccines. They may actually need vaccines as well, but there obviously could potentially be costs involved, but it's always worthwhile having the chat with mum and dad as well. It can and will be time consuming. To avoid errors, you need to be given some quiet time if possible to do these catch-ups, and always have someone else check and agree with what you're suggesting as a catch-up. And finally, a catch-up plan will need to be altered each time a person doesn't turn up. So if Jack comes in and he's on a catch-up plan and was due 4 weeks prior but didn't turn up for it, that whole catch-up plan needs to be done again to alter for the different dates. Okay, so questions, anyone? Again, if you pop it in the Q&A section, which is at the top of your screen next to the people, next to chat.
There's a question just around how do we arrange an interpreter, and are they free in WA?
So as far as I'm aware, new immigrants and new people arriving to Australia get three medical documents done, interpreted for free. They can go to the Department of Social Services or Home Affairs, and they will do that interpretation for them. If in WA, if you are needing interpretation, MCDC on their request form has a tick box. You send in that that plan with the tick box saying that yes, you want it interpreted. It does take a couple of weeks, but they will actually get it interpreted for you.
There's just a few questions.
Sure.
That's no more questions.
Oh, that's not great.
Okay.
Excellent. Moving on.
So Michelle, did you want to talk through your?
Yeah, that'd be great. Thank you. So on our website, which is servicesaustralia.gov.au, we do have quite a lot of education tools for you. You'll be able to see about those of you that may have PROTA responsibilities to actually give people access to the air. You'll see advice for that. Also accessing the immunisation register. And we've started to actually put on some simulations as well. Most recently, the Air 42A report. There's a simulation to walk you through that, and any other new reports that come along will also be adding that to the air, as well as infographics, you know, cheat sheets, so to speak. So do have a look if you've got a question or you've got anything you need some assistance with. Next screen, please. Brilliant. Yeah. So as I said, you've got accessing air, submitting to the air, and the air reports. So reports are really good and handy to run. You can, you go in and you request it once, and you can ask it to give you a fresh one every week, and it's up to yourself whether or not you need to or get to it each week. But you'll know it'll be sitting there ready with up-to-date data. So very handy to use those. And then last screen, we've just got some contact details for you. There you go. For the air, HPOS messages, which is part of your PROTA account. If you've got an individual PROTA account, is where you can actually contact the air directly and have personal details for people, and it's secure. So you can use that, or of course you've got the telephone numbers there as well.